Hey mamas, before we dive in, a quick heads up. This is a two-part episode, each about 30 minutes long, because we packed so much goodness. If you're listening on Spotify or watching on YouTube, we highly recommend the video version so you can check out the diagrams and tools we reference. They're super helpful. Also, we ran into a few audio issues while recording. Mom life, right? So apologize in advance, and we appreciate your grace. We did everything we could to clean it up. Now, let's get into it.
Hi guys, welcome back to Two Moms, Too Much Coffee. This is Jhshell. We also have,
It's Tempest.
and then we also have one of my besties, Monique. Monique is one of my friends that I met I was in OT school. She was in PT school. So
Mhm.
hey Monique.
Hey,
Hey,
Monique.
hey, how's it going? I guess I'll introduce myself here. Like I'm a physical therapist. I treat orthopedics and pelvic health. I've been a physical therapist for about 6 years now, and I'm a wife and a mom.
Yay.
Yeah.
Aw, that's so cute.
My
I wonder one
little
day if I'd
intro.
introduce myself as a wife. I
He needs some credit too. Let the husband be known.
No, I really thought it would, but I love it. It's so sweet.
It is. Also,
Thanks.
Tempest, I don't even know if you know like the background of being Monique, so I'll just share with you and with the followers.
Yes, please.
So when I like first started grad school, I was in a flex program, so I would have to drive every other weekend to St. Augustine. I live in Tampa, so that was like almost 4 hours, and I would do that literally.
A
Yes,
4-hour drive?
yes. So what was it, Monique? Probably the first year was probably like every 2 to every 3 weeks I was driving there.
That's
Probably
true.
more every
Yeah.
three. Yeah.
Yeah. That was a lot at the
And
beginning.
I would get a hotel because I didn't have anyone that would stay, like I could stay with. I didn't know anybody there. So every weekend I would get a hotel. So the first like 2 or 3 weekends, that's what I was doing. And then Monique had asked me, she was like in my group, the first like what project we had. And she was like, girl, you're staying in a hotel? And I was like, yeah. And she's like, no, you're not doing that anymore. You can stay with me. Literally just met the girl probably for like a month at this time, month and a half, and literally stayed with her. And from literally whole 3 years, I stayed with Monique every time I went up there. She saved me some coins, and
Yeah,
we
man.
became OTPT besties. And she would yell at me for not eating breakfast in the morning.
It's very important. It's a staple for the day. Okay.
Yeah.
Yeah.
So that is how me and Monique came really close. And then she had her son not too long ago. And then now we have Naya and Sequoia. So yeah.
Oh, look at
Yeah. Oh, and
us.
my son is Irie. He's like, oh, he just turned 10 months 2 days ago. So yeah.
Oh my
Yeah.
gosh, that's crazy.
Yeah, I know. He grows so fast. Oh my goodness. But I
Yeah.
appreciate all your pediatric OT advice.
Yes.
Yeah.
Yeah.
Very
Love
helpful.
it. Also
Yeah.
appreciate everything. I text you for pelvic health, which is kind of why
Oh,
we're here. Um,
yes.
So just kind of like jumping in, why we really wanted to do like an episode really on like moms taking care of themselves is because me and Tempest have like similar like health, not really issues, but like problems, I would say. We both have, I had before already knew fibrocystic like breast disease, I guess. So I've had to like get ultrasounds every 6 months to make sure that it doesn't turn into breast cancer. And I had to do that literally, 2 weeks, 3 weeks after Naya was born. So in January,
Oh,
February, I had to go. And they couldn't even see anything because I had milk. So they were like, oh, you'll have to come back. We can't see anything. And I'm like, so do I have breast cancer or no? And they're like, you'll have
Oh,
to
that's
come back.
scary.
As a mom, they're just kind of like, oh, we can't see anything because you have milk in your boobs. And I know Tempest, kind of
mm,
similar to you.
yeah. So, so I guess my story is a little different when it comes to like my lumpy boobs, but so I actually, since I've talked on this podcast that I've had an overproducer most of the time, I just assumed that I had um, clogged ducts in my boobs. And so the funny thing is, I don't know if any of you guys watched The Bachelor, but Katie from The Bachelorette, she just found out she has breast cancer. And she
Yeah.
was like, everybody, you should be checking and you should get every lump checked out and whatnot. And then I was thinking, I was like, I actually have this lump in my boob that I assumed it was a clogged duct, but maybe I should just bring it up to my doctor. And I have a history of breast cancer in my family. My aunt died of breast cancer. And so I was like, well, you know what? I'm going to go ahead and get it checked out. And so I messaged her and she was like, it likely is a clogged duct or something of that nature, but we're not entirely sure. And so she went and felt it and basically said, yeah, it doesn't feel like quote unquote cancerous, but it also doesn't feel like a clogged duct. So I had to go get an ultrasound and a mammogram. And knowing what I've heard about mammograms, everybody's like, oh, they hurt, blah, blah, blah. And I must just have like a very high pain tolerance because I didn't think it hurt at all. But so I had to go in and get a mammogram and from the mammogram, which they gave me the diagnosis or the results. They gave me the results like within like 5 minutes. I was very blown away that it took such a short amount of time. I'm kind of like, if you can do that, why do we wait so long for everything else? But whatever. I'm not solving healthcare today. But so then I ended up, they said that they couldn't really see everything because I had recently pumped right beforehand, but obviously there's still a lot of milk in there anyways. And so they wanted to do an ultrasound. The ultrasound, which was the expensive part, my insurance did cover the mammogram. The ultrasound was like $600 after insurance. And basically they found a few different some sort of lump. I don't know what it's called, but basically it's like something inside of the milk duct. But it's not, actually it says likely benign or probably benign, something like that. And I was like, what do you mean by probably?
Yeah.
Could you elaborate on the probably part? And I have to come back once I'm done breastfeeding to do another one.
Yeah, that's what I get every 6 months, something in the mail. Every time I get an ultrasound, it's like probably benign. And I'm like, sick.
Probably.
Cool.
Wow. But you know what's crazy? I feel like that is the theme with all women's health. Like there's a probably, there's a we're not sure. And it kind of blows my mind because all these other health conditions that I treat in physical therapy, it's like we've known how to fix it for so long. It's in the textbooks. There's like a protocol. But when it comes to women's health, it's like, probably. And we're just going to kind of leave it at that and figure it out as we go. And that's pretty crazy to me. So, yeah.
Yeah, truly. And I'm like, oh, so relieved. Like, oh, it's not cancer. But it's also, it very well could be. So it's also like, cool. It's like, it's not cancer for now. So that's the cool part for me.
So Monique, you mentioned you do orthopedics, and then of course we have you because of pelvic health. But if you want to tell us a little bit about pelvic health, what is pelvic health, or what is the pelvic floor in general for our listeners who don't know?
Gotcha. So pelvic health is basically a group of, well, I'm treating a group of muscles that start in the bottom of the pelvis and they help support the pelvic organs. So anything related to urination, bowel problems, pregnancy-related things, or sexual dysfunction. So I brought me a handy dandy little model. I can show you guys. I use this like every day when I talk to my patients. It's funny the amount of people that like have no idea what this looks like. Even healthcare practitioners are like, "Oh yes, please show me the model." So
It's scary.
Yeah. I mean, honestly, I didn't really know before I took all my pelvic health courses because orthopedics, you don't really need to know pelvic health that much. So like it's not your specialty. Like, you really just don't look at it. And then after grade school, I mean, you don't learn anything about your pelvic organs. So the general population just does not know. Here we go. This is my little pelvis. You kind of see here. It's got the pelvic organs in there. We've got the rectum in the back. You've got your uterus right here, and then fallopian tubes, ovaries, and the bladder. Does this look familiar to you guys at all?
Well, I just looked at an MRI of my fibroids, so yeah.
I actually actively look at my body this way. So yeah.
Oh, right. Okay, good. So you're different than most of the people that I see. So that's awesome. I was excited for y'all. Okay. So basically, when we take these pelvic organs out, we've got our pelvic floor. So that's the group of muscles, and you can see they kind of form like a pole. It's different on TV than in person, but it forms like a pole. You've got your external muscles, so you've got the anterior pelvic floor, the front side. You've got the posterior pelvic floor on the back side, and then you've got your deep pelvic floor muscles there. So all of those are supposed to work with your diaphragm, this muscle up here, and breathing, and it's supposed to be about like pressure management. So when that gets kind of thrown off, it can affect bladder, rectum, and then any kind of sexual or baby related things. So that's kind of the majority of what I think.
When you were going through your postpartum, were you like, did you feel like, oh, I know exactly what's happening because I'm a physical therapist? Or were you like, ooh, maybe I need to go to my own pelvic therapist?
I actually expected everything to just be super smooth. I thought, oh, because I'm a pelvic PT, like I already know what's coming. I remember my dad's wife, she's like a primary care practitioner, and she was like, oh, so this is gonna happen, that's gonna happen, and I was like, I didn't know. I'm not a pelvic PT. I'm in healthcare. But after I had the baby, it was like mind blowing. Okay, the amount of stuff that I just didn't know. So I think having a baby in general like really opened my eyes and has kind of made me a better healthcare practitioner. Because I also had some like pelvic health things happen after I gave birth. So like my pregnancy was really easy. I was like, oh, I can do it. I was hanging out, having fun. And then the actual birth, it kind of it's a little rough because my baby was a cord baby. So he got all tangled up in the cord and he was okay, but we ended up having to do C-section. And I think I underestimated how intense it was to recover from a C-section. So I had a lot of pain. And, I had some patients who had it, of course, and not all of them were in a lot of pain or they just didn't like express that to me and how much it affects your day to day. So I was really surprised at that. And then the actual postpartum was really tough, like hormone changes, all of these extra little things that I didn't realize happened with the pelvic floor. But I mean, they teach you these things in school, and I help patients to a certain extent, but there's a lot of little details that you don't realize until you go through it yourself. So I ended up having a pelvic organ prolapse, which is one of the more common things I treat, almost like one of the scarier things. Like most practitioners before they have babies, they're like, "Oh my God, I'm so scared to have a prolapse. I don't have a baby because I'm scared to have a prolapse." But now that I've actually had one, I realize it's not that bad, and I feel like I know how to help my patients get past it a little bit better and deal with it and manage it.
Yeah.
When you say pelvic floor prolapse, for the people that are not like medical or in healthcare, is that when people would say that your vagina's falling out?
Yeah, that's most commonly what I hear and what people think, but it's not that bad. Okay, so we'll go back to the model. So we've got the pelvic organs here. Basically, let's just take them out so we can see them a little bit better. You've got the bladder sitting in front, like uterus is this one up top, bladder here, rectum behind, and then right here is the vaginal canal, so that kind of connects to uterus. So basically, any of those three organs, bladder, uterus, or rectum, you kind of start to push on the vaginal canal, and so that'll cause the tissues of the vaginal canal to kind of dip forward and protrude towards the opening of the vaginal canal. So that's why they're like, oh, like the death falling out. But it's not really. And there's different grades of prolapse. So like you can have anywhere from a grade 1 to grade 4. And typically the grade 3 and 4 are like where you can actually see it coming out past the opening. And so most people don't realize they have one until it's a grade 3 or 4 because doctors tend to not really check for them until they're that far along. Yeah, and women don't know that that's even a thing and check for them. So worst case scenario, a lot of like older patients for sure, they're like grade 3 or 4 and it's falling out. But if you figure it out early that you can kind of prevent it, like I'm like in between a grade 1, grade 2, so it's not actually coming out. But my bladder is starting to like push on the front wall of my vaginal canal and it's like kind of dipping down. So that's something that pelvic floor therapists can kind of see. And an OB can see it too, but they tend to not check just because, it's not anything they can surgically fix. But with pelvic health therapy, you can help try to firm up those tissues and kind of help the pelvic organs to like resettle back into the place that they want to be. And that'll help prevent a lot of problems like leakage, incomplete emptying, urination, or bowel movements, or even like pain effects. So it is something that you can treat, and yeah, very you can't like fix it, but you can help manage it.
That was my question. Like, can you fix it? But it's not fixing it. You just like are strengthening those muscles.
Exactly. And the thing with like, sorry if this is word vomit. Are y'all good so far?
Yeah.
Okay. The thing with the prolapse is like it's, I guess it's controlled by ligaments. So when those ligaments become kind of loose, which happens, during pregnancy in general, you get really lax in these. And when those things happen with the prolapse, I think the ligament actually doesn't go away. So you can never like once the ligament is lax, you can't tighten it. You can fix a muscle, you can fix a bone, but with ligament, you can't really like make it go back to normal unless you do surgery. So a lot of people tend to just opt for surgery because it freaks them out. They don't want to deal with it. And then, in general, it's not the most difficult surgery to get past. I mean, any surgery in your pelvic region is going to have repercussions, but compared to like a knee replacement, a rotator cuff repair, like it's an easier surgery.
It's so interesting because which I'm sure we'll get to, but I have some diastasis recti, the ab separation, and I have also a hernia. And I had read that I'd read that like the way to fix it is surgery. But then I had talked to my doctor, and then I also went to a pelvic floor therapist, and they had said that, we can do some workouts and some rehab on it to close up my abs that might help the hernia. That surgery might not be necessary. However, some reason, which is kind of crazy to think, it feels like the easier way out to do surgery, or at least the quicker way, because I feel like with pelvic floor therapy seems to be like it's gonna be some time before my abs are anywhere closer than they were.
Yeah, I'd say that's accurate. A lot of people, just go for it because in a way it's an easier option. The repercussions for a surgery like that are going to be like scar tissue, like your myofascia tends to be kind of restricted, so it won't really affect you now, but maybe when you're older, you might have difficulty with like bowel movements, or you might have some like gut health issues, just because your fascia in your abdomen, is just kind of taut and things like that. And then the usual things that come with surgery, like having to go under anesthesia, and that in itself, can cause like constipation, and so that can cause pressure management issues. And sometimes the issue with your abs being separated can kind of throw off the coordination of your pelvic floor. So remember earlier I was saying it goes with your diaphragm. So basically you can like inhale, your diaphragm is supposed to drop, and your pelvic floor is supposed to drop, your belly is supposed to lengthen. When you exhale, all of those things are supposed to rise together. So that coordination will be a little bit thrown off. So if you don't do the rehab, whether or not you have surgery, that can still kind of be off, which, eventually becomes a problem. So the surgery is like an easy fix in a way, but I think it's still good to go ahead and do therapy.
It's like an easy fix for like right now, but then later on you're still gonna, yeah. What are other like symptoms or anything like that you think that moms should pay attention to for needing pelvic floor therapy? Or do you think like all moms should just, once they have that baby, go ahead and get in therapy without being a shameless plug? Obviously.
Honestly, my advice, I mean, I think that all women should do some form of pelvic therapy, either like before they give birth or after they give birth, or just in general, just to kind of like, check out how things are and see how it's going. Because I see some patients that don't necessarily, or haven't had kids and still have some pelvic floor dysfunction, and sometimes like it can be fixed. Sometimes it's long and tough, like the diastasis, but sometimes it's just like a little coordination change, and they do better. I think that it is beneficial for all women. Yeah.
Yeah.
But honestly, like I treat men and like some transgender people too. So everyone I think can benefit from a little bit of knowledge on the pelvic floor.
Yeah.
I actually, now that, I mean, it probably sounds really stupid, and I guess I'll just be the stupid one here. Did not even think that men could have a pelvic floor dysfunction, but it makes sense.
Yeah,
But I
yeah.
didn't think about it at all. I just assumed it was like a woman issue, as like most things in life are.
Yeah, no, men, because the pelvic floor supports, you know, bladder and rectum, it's not just the uterus in there. So, or I guess in men, that's not in there at all, maybe that and a prostate. But those things can get thrown off too. So with men, it's like a constipation, like emptying. They can just have pelvic pain in general, or maybe their genitals don't work properly. And same thing can happen with women, like, whether or not they've had kids, like they can have problems with sex, it can be painful, or they can have lack of sensation. Maybe they can't have it at all. So both men and women have these problems. So yeah,
Yeah,
everyone will be first on the floor.
that totally makes sense for
Yeah,
sure.
it does. What was
You're
it?
gonna send your husband to pelvic floor therapy.
Yep, calling them right up. Like, let's all just do a family trip to therapy.
But I'm
It's
happy to hear that you did pelvic floor therapy. That's so awesome.
Yes. Well, so I have a vanity issue, and so not an actual spit take. An ex once upon a time told me that I wasn't funny, and like, I think I'm hilarious, and I just got validated. I just wanted to say that.
I think it's like your delivery, honestly, because like you always, it sounds like you're gonna say something really serious. You did it on the last podcast too. You're like, in short, no, but like it's like I think you're gonna say something very serious, and then you don't, and it just like takes me out. I'm not prepared, I guess.
Yes, but anyway, so yes, I have. Um, I like the look of my body the way that it was pre-baby. I know it's never going to get back to that, but I do know that separation makes it worse. And I'm on my second kid, and I don't think I got it rehabbed enough in between the two children. I was working out a lot and I was doing some things, but I never really worked my core the way that I probably should have. And so it is now much further apart. I think it is like two at the top, three in the middle, and one at the bottom. And so it's like, at least that's what my physical therapist says. And so, and then when I say that, it's centimeters, right? Or like three fingers.
Or like finger width.
Yeah, three finger widths apart and two finger widths apart for people that don't know what that means. And so I'm there like trying, doing all the deep inner breathing, inner ab breathing.
Yeah, the
And
breathing.
it's interesting because I've been doing it for 3 weeks now, and she had said nothing has changed yet, which is not surprising because I'm really bad at doing it at home without her. And she's like checking it. I'm like, yeah, there's no way because I took almost a whole week off for vacation. Uh, so anyway, regardless, I am now in it, and so, but she had originally said that we should see some movement within like 6 weeks, and I thought that was surprising. I wouldn't think like 6 weeks would do much with just kind of like what we're doing. It doesn't feel like it's doing all that much. It's like such like small, breathing stuff that I expect like a lot of movement if we were doing like, weights or something, but obviously that's not how it works.
I say that that's accurate. Like I agree with that. Because for muscle change, whether this is, women's health or just, exercise in general, like it takes at least 6 weeks to see clinically significant improvement. Um, so strength training at least 3 times a week will take effect in 6 weeks. So staying consistent with your home exercise program is very important. So even if you just do 3 days a week, it's gonna get it done. And then with the breathing stuff, that's the thing I was saying. Like it's kind of an easy fix sometimes. It really is just coordinating with breathing, and then you can add weights and maybe some stuff to it. So like once you get it down, you can practice it in your day-to-day life. Like, oh, I'm picking up my kids. Let me practice doing my breathing thing. Or oh, I'm picking up all the toys or something. Let me practice, bracing the core, doing my breathing thing. Um, But yeah, I mean, that's also one of those things like with the ligaments being a little bit loose, they will always be a little bit loose. So, if you want it to ever completely be gone, you can do surgery. But the thing is pelvic floor or with women's health physical therapy, we're kind of train your ab muscles to like kick on and close as soon as they activate. So as long as they're, closing when they activate, and that's all you really need. And then you won't have back pain or, hanging core and all that vanity stuff.
Vanity stuff. Breathing though is funny though, Tempest, because it seems so easy, but Mo came to visit. I think I was 3 months postpartum, and she was checking to see. I can never say the word. Diastasis. I always want to say diastasis. Is that right or wrong?
I think we all say it a little different. Like I'm Texan, so I say it all kind of crazy.
A little thing with your abs, recti. So she was checking me, and then she was having me do breathing things, and she was like, "No, that's wrong." I was like, "What do you mean?" She's like, "You're not like connecting your cord." I'm like, "I am." She's like, "No." Like I had no like my cord connection, like my mind, body, it was like gone. And I was like, "Oh, I work out, I lift. Like that's gonna be easy for me to get back to." And I could not. I had to focus just to do diaphragmatic breathing, like really take it in because I was like, this isn't, if nothing's connecting anymore. And then she made me do my home exercise program. So
yeah, I'm keeping up with it. Have you been keeping up with your home exercise program?
What are you saying? No, I'm just kidding. Yes, I have been, but it's kind of fallen off lately. But I was really, really good at it at first. But I'm also back in the gym. So like what do you say about that? Like if I'm still in the gym, I'm still doing all my good things there. Should I still be like do women? Is that something we should be doing every night just to maintain since those ligaments are never going to go back? Is that like your recommendation?
I think it's good just as like if anything like a warm up before you do your workout at the gym.
Mhm.
Take a couple of minutes to like focus on your breathing, make sure your coordination is right. So like, am I bracing my core? If I need to, am I bracing my pelvic floor? Am I when I exhale like properly engaging my abs instead of like bearing down and having poor pressure management? Making sure you rebuild that connection, just in a little 2-minute breathing exercise, and then you can do your workout and then you'll rebuild strength that way, because you're going to work this muscle out regardless. It's just whether or not you're doing it properly.
Mhm.
And that's, once you figure that part out, I really tell people like there's no restrictions. Like people are like, oh, I'll never squat again or this and that and that. I won't run again. Like, no, as long as you can figure out your proper pressure management and coordination, you can do everything you need to do. And it's going to help train those muscles. I would say women everywhere, a little 2-minute, have somebody help you figure it out. Once you got it, practice it a little bit here and there, maybe 3 times a week. For clinically significant improvement. And then you should be good to go.
So when you say like ligaments aren't going to go back, everyone keeps asking me like, am I going to have another kid? But now I'm like, so you telling me that they're going to stretch more? And we're not going to be like anymore. I was just like, yeah, number two.
I mean, everybody's a little bit different. Like some people, because with pregnancy, you have these hormones that cause ligament laxity and loosening of things, and then yes, a lot of those will kind of start to tighten back up, but not all and not always. Kind of just depends on the person, your health status. I can tell you how old you are when you have kids, things like that. I mean, there's like supplements you can take supposedly to help rebuild like collagen and things like that. And I'm sure that helps. But everybody's different. You kind of just don't know until you're in it, what's going to happen. So yeah, I mean, in theory, it'll close back up and, optimal scenario, it'll get tighter. But I think there's always going to be just a little bit of laxity, a little bit of looseness. And for some people, if it's still present, maybe 3 months or, well, let me get more into that. Okay, so while you're breastfeeding, those hormones tend to linger a little bit longer. So, say, like if you breastfeed for 2 years, then you might have some of those hormones lingering that will cause the lacting for a lot longer than someone else who's starting breastfeeding a lot quicker. So, the likelihood of your ligament then tightening up is maybe not as good as somebody who stops seeing that. It's kind of crazy. But you might also just be lucky and they close back up. everybody's different. It's like, some people will have their cycle while they're still breastfeeding, and people will not at all while they're breastfeeding. It's hard to say. Um,
So
yeah.
say, for example, there's somebody that is breastfeeding, has their cycle, and has a 3-finger separation. Name starts with the letter T. So you're telling me I'm stuck this way.
Not necessarily. I mean, how long did you breastfeed with your first?
Around 7 months.
Okay. Okay. And then how far are you with your second? Like, I don't know how old your
She's 5 months. She's 5 months.
5 months.
So my goal is also around 7 months with her.
Okay. Okay. I mean, you'll be able to tell a little bit better once you kind of start weaning off the breastfeeding. So, I mean, I can probably answer that question better for you when you're like maybe 8 months, 9 months in, and you see how your body starts to respond. But for you, it might stay a little bit loose, but it might close back up because you're also young and healthy and you work out and you're very conscious of your pressure management. It sounds like because you have your own partner that's helping you out. So there's potential there.
Okay. I'll I'll hold that potential.
Sometimes when we have conversations like this and people are like, "Oh, are you gonna have another one?" And I'm like, I really wanted to have a sister or brother, but sometimes I'm like, I had a pretty healthy pregnancy besides the fibroid scare. I had a pretty great birth experience, and I'm a little stretched out, but not too crazy. So do I really want to push my luck to then the second time be like, terrible pregnancy, scary birth? Like, do I really want to push my luck here? I don't know. Is that selfish of me? Probably, but
Jumping out of going skydiving twice. Like my whole thing has always been like I skydived once and I survived. The odds of jumping on an airplane twice and surviving, I feel like are lower. So I don't know.
Yeah,
So sorry, go ahead.
I have those same fears, with considering having a second child. Like I would love to, because I mean, just having a child in and of itself, like I've never really felt that kind of love before. I mean, this amazing new thing in my life. It's changed my life so much. It's wonderful, but it is so much on your body. So just consider like starting over and doing that again. It's intense.
Yeah. Especially because I'm like, I want them to be close in age. And I'm like, I feel like as soon as I'm like, everything's back, I'm going to have to stretch back out again. And I'm like, damn. Like, wow, I'll probably stop breastfeeding. And then, I mean, Tim is, then you'll have to like restart that again. So, yeah, I don't know. TBD. TBD. Also, people just stop asking me anyway.
Is like the cutest thing you could probably ever see. Like, so at least there's that. Just you don't look in the mirror,
But then I'll get patients that have like 7 babies in a row, and they just like bounce back. Like they come in for their 6-week postpartum visit, and they're like their belly is up flat, and they're just wearing their leggings and their pre-pregnancy clothes, and they like have a baby on my hip, and they're like, "Let's do squat," like it's nothing. So I'm lucky and be one of those. They give me hope.
Yeah.
I'll add that to my potential bucket.
Hey, thanks for joining us on Two Moms, Too Much Coffee. Don't forget to like and subscribe, and feel free to leave us a review.